A torn rotator cuff is a common condition that can cause shoulder pain, weakness, and loss of mobility. If the tear is severe enough, surgical intervention is often necessary to repair the rotator cuff and to restore shoulder function. There are three bones that are involved in the shoulder: the humerus, the scapula, and the clavicle. The rotator cuff is made up of a group of 4 tendons and muscles that surround the shoulder joint. These muscles are the subscapularis,
the surgeon will make small incisions around the shoulder joint,
the supraspinatus, the infraspinatus, and the teres minor, and together they work to stabilize the joint and move the arm.
And improve visualization.
A fluid-filled sac or bursa protects the tendons of the rotator cuff and allows them to slide smoothly as the arm moves.
Using the video monitor as a guide, the surgeon will locate the problem area and make
rotator cuff tears occur when at least one of the cuff tendons is torn, fully or partially detaching the muscle from the humerus. These tears are most commonly caused by either cumulative injury through repetitive motions, such as in throwing sports and weightlifting, or by a sudden or acute injury, such as a fall.
Diagnostic shoulder arthroscopy.
There are 2 main categories of rotator cuff tears: partial tears and full tears. This animation discusses the repair of a fully torn rotator cuff. Please see our partially torn rotator cuff animation for additional information. Surgical repair techniques vary depending upon your surgeon's preference, the severity of your tear, the tissue quality, and your individual anatomy. These techniques include open repair, mini-open repair, and arthroscopic repair.
Shoulder arthroscopy is a procedure
this animation will explain the common arthroscopic repair.
Inside the shoulder joint. Problems may include arthritis, bone spurs, or a
depending
torn
upon your
rotator
preference
cuff.
and that of the anesthesiologist, you will be put under general anesthesia and/or a nerve block.
Used to see inside the shoulder.
Your surgeon will make 1 or 2 small incisions around the shoulder joint. Next, a cannula will be inserted into the incision, and saline solution will be injected in order to expand the joint to allow the placement of a small camera or arthroscope and surgical instruments.
Saline solution is pumped into the joint to expand it.
Once placed, the arthroscope will display images into a video monitor, and your surgeon will use these images for guidance during the procedure. In order to provide more room to protect your repaired tissue, many surgeons will remove bone spurs from the underside of the bone above the joint, known as the acromion, which is part of the scapula.
Instruments are removed, and the incisions are closed.
Your surgeon will remove severely damaged or scarred tissue from your torn tendon.
Risks are minimal and may include infection, tissue damage, or blood clots. Diagnostic shoulder arthroscopy typically is an
implants called suture anchors are then placed in order to secure the repaired tissue to the bone.
After your
surgeon will then pull the tissue over the top of the head of the humerus for reattachment.
To prevent the development of any weakness or stiffness. You will have a
typically arthroscopic rotator cuff repair is performed in an outpatient facility, and you should be able to go home the same day. Pain and swelling after the procedure is normal and will decrease over time. You may be prescribed medication to manage your pain for the first few days and as needed. Depending upon your specific needs, your surgeon and physical therapist will develop an exercise routine to gradually increase your range of motion and strength. Complete recovery can take from 4 to 6 months, depending upon the severity of the tear, the type of repair, and your individual healing process. Patients typically experience high satisfaction with rotator cuff repair, and in combination with physical therapy, many people experience significant pain reduction and recover much of the lost function of the shoulder.
Saline solution is pumped into the joint to expand it and improve visualization. Images from the arthroscope